Predicting lung cancer survival from PET CT scans isn't just about if a patient survives, but when. A new study from Uppsala University introduces two advanced temporal modeling strategies for non-small cell lung cancer survival prediction using 2D PET CT projections. The researchers evaluated a baseline time-conditioned survival model against two new architectures. First, attention-guided time-conditioned survival, or ATCS. ATCS replaces element-wise interactions with a cross-attention module, fusing image features with learned time embeddings. This allows the model to condition intermediate representations on follow-up time, adapting feature importance dynamically. Second, multi-time survival, or MTS. MTS predicts discrete survival probabilities at 6-month intervals up to 5 years. A key technical innovation here is the enforcement of monotonicity. MTS defines each output node as the cumulative product of its predecessors. This ensures the survival curve is non-increasing over time, a physical constraint often violated by standard neural outputs. For inputs, the team used tissue-wise projections classifying bone, lean, adipose, and air, combined with tumor-specific masks. Ablation studies show that integrating global tissue context with local tumor information consistently outperforms tumor-only inputs. Results on a held-out test set of 292 patients show both methods beat the baseline mean AUC of 0.767. ATCS and MTS both achieved mean AUCs around 0.793 to 0.794. However, their strengths differ. ATCS excels at early time points up to 3 years, while MTS dominates later intervals, from 3.5 to 5 years. The study also reveals a trade-off in temporal resolution. Finer discretization, like 10-day intervals, improves short-term discrimination, but increases error propagation in cumulative chains, hurting long-term stability. Coarser 6-month intervals provide more robust long-term estimates. Cohort saliency analysis further shows ATCS shifts focus from tumor-specific regions to broader anatomical context as time increases, whereas MTS maintains stable spatial importance patterns. The conclusion: temporal parameterization fundamentally shapes predictive horizons. ATCS and MTS are complementary, suggesting hybrid ensembles could optimize risk stratification across the full survival timeline. This work underscores that architectural design and temporal constraints are critical for clinically interpretable and accurate prognostic AI.